Why on earth would they want to bring more positive patients into a nursing home that houses the most vulnerable part of society?
Tonight, sons and daughters worried about their fathers and mothers. Families already forced apart, now concerned as outbreaks continue to ravage nursing homes across the country, including more than half a dozen here in Mecklenburg County. Thanks for joining us. I'm Phil Orban.
And I'm Genevieve Curtis. Those inside the homes cut off from their families for their own protection, but still feel helpless as they see the cases surround them. Some of those cases include the people that are paid to take care of them. Now, after we pushed the county, it released this list of 7 homes in Mecklenburg County with confirmed outbreaks. Tonight, we've learned that positive patients are actually being relocated to Huntersville Oaks. Channel 9's Aaron Edwards is live there now. Aaron, you spoke to the son of a resident who is now afraid for his father's health.
Genevieve, Tom Williams says he just can't believe that Huntersville Oaks would choose to bring more coronavirus patients here to a facility already filled with high-risk residents like his 93-year-old father.
I was unaware that there was any virus in the Huntersville Oaks facility.
Tom Williams' father is about to turn 94. He moved into Huntersville Oaks on February 29th.
So it's only, it's been 6 weeks.
Williams heard about the outbreak at the Atrium-owned facility from a friend who saw it on the news.
I immediately tried to contact them and couldn't get through to speak to anyone to verify it.
Later, he received an email from the facility saying there was an outbreak. But as surprising as that was, it's what came next that he couldn't believe. It said that Atrium would be relocating COVID-19 patients from other facilities to Huntersville Oaks.
I thought they had lost their minds.
Huntersville Oaks says it will keep the transported COVID-19 patients in a separate wing, but Williams says it's alarming.
It's unfathomable to me why you would bring, something that is known to be like the most virulent disease that known to man, and bring it into a nursing home that has residents there who are the most vulnerable segment of society.
Another part of the email that has Williams' concern is this line that reads, "To the extent possible, we have limited teammates from working in multiple areas of the building to prevent cross-contamination."
They did not say that they would definitively, have dedicated staff for the COVID wing.
After spending 3 hours trying to call the facility, Williams has yet to get answers. We also reached out to Atrium to ask about their decision to bring coronavirus patients to the nursing home. They said they could not answer those questions at this time. The facility has not said where those other patients will come from. The email just said they'll be from other Atrium facilities. We'll, of course, continue to stay on top of this and bring you the latest as we get it in. Genevieve?
All right, Aaron, definitely a big concern for loved ones tonight. Aaron, thank you.